Hello there. I just got back from a really nice interview with local dentist and business owner and fellow member of Together Portishead, Nick Williams of Limetree Dental Practice. Nick went into a few things. He went into how he got into his line of work and a little bit about the practice, but he also gives some really useful advice both on oral hygiene but also um, on as a local business owner who's been running a successful practice for 20 plus years here in Portishead. If that sounds useful to you, and it certainly was useful to me, uh, I hope you enjoy. I'll be providing some links in the content of this at the end, and also probably in the body of whatever social media post you've encountered this on. And if you're a local business owner and would like to have an interview like this that you can put up and about, um, I'll be providing details on that at the end as well. So yeah, hope you enjoy.
Yeah, yeah, right. So shall we start with just a bit of an introduction, your sort of 60 seconds
Yeah, sure.
of a bit about yourself and the practice?
Yeah, so I'm Nick Williams. This is Welcome to Limetree Dental Practice. We're a private dental practice based here in Woodhill Road in Portishead. And we've been open for 21, nearly 22 years this year. And we look after the needs of patients from all over the town and region and further afield. Over the years, we offer a wide range of dentistry and dental care, from general dentistry for many people, whether they pay as they go or they join the membership plan. But we also offer cosmetic tooth straightening with aligners and braces. We offer cosmetic dentistry, whitening, crowns, veneers, but also we offer gum treatments with a dental hygienist. We offer dental implants and also cosmetic comfortable dentures with my colleague Lacey.
Nice. Do you have a particular band of customers? Is it everyone in the town?
Whole population. Whole
Whole
population.
population.
Those who want to come and use our services and can afford our services is for everybody. So there's no minimum age, there's no upper limit. We can see everybody, the whole family. We're a family-owned practice. I own the practice, and my wife helps us out. And that's a nice part of it. They were recognised around Portishead as Nick and Anita working at the dentist.
Yeah.
And people know our children as well, and we see babies from when they first get teeth right the way to their grandparents and great grandparents, whoever wants to come along.
Nice. Brilliant. We've got, a lot of people get into their line of work almost by accident. So a bit more about you personally. I'm guessing that's not the case with dentistry?
No, it's not really something you fall into accidentally or by just that saw an advert. It's something you have to have done a lot of training in.
Yeah.
It's a long-winded career pathway. Obviously, most people would go through the normal GCSEs and A-levels and then go and study a degree in dentistry. However, there are other pathways with people getting degrees first. Like my colleague Lacey had a degree in forensics before she became a dentist. So she offers the local police and coroner's office a service of forensic dentistry. So she will go and examine for the coroner over at Flaxbourne. But as far as I'm concerned, yeah, I did the normal pathway in. I did GCSEs, A-levels, 5-year degree in dentistry at the University of Birmingham, and then did a 1-year in-practice training program. Then it was called the vocational training. It's now called Foundation Dentistry Year. And that's where you work in a practice under the guidance of another practitioner. So you have your own surgery and you have your own patients, but you've got somebody you can call on for help and advice.
Right. So is it almost like a kind of franchise thing, or is it like you're under another brand?
Well, you're working in another practice. It's not a franchise. It's just a small practice or a big practice or a group of practices might have a few slots, but there's just a surgery go in you're a qualified dentist, but you have the ability to call on a more experienced practitioner as a mentor to help with training, and also going out day release. One day a week out to a training centre to meet with other dental practitioners who were in the same situation.
Oh, cool, cool. So you worked before Limetree Dental. You were working for another practitioner.
So yeah, so before I came to set up Limetree Dental practice back in 2003, prior to that I'd done my vocational training in a practice in Telford. So I stayed in the Midlands area, having qualified in Birmingham. I stayed there for 2 years in total, doing a year as an associate there. Then I went travelling to Australia, and I was a dentist in several guises around Australia, including a flying dentist to the Great Barrier Reef island of Palm Island, and also looking after hospital patients, Aboriginals, etc. Then I came back from Australia, and I was working in Weston-super-Mare. Moved to Portishead, and several of my friends, particularly some neighbours, said, "Oh, you could do something about dentistry in Portishead." And so I started thinking about the idea. And then, and that's when myself and a former colleague bought the property here on Woodhill Road and converted to a dental practice.
Right. So did you move to Portishead because you recognised a niche, or?
No, we moved to Portishead personally because I was going to be working in Weston-super-Mare. I had the job to come back to after Australia, and my wife was likely to be working in Bristol because of the career she was in at the time. And so as a result, we were looking around on the west side of Bristol, saw Portishead. There was the Vale was just being built. They were promising the marina development at that point, and it seemed nice. And our long-term aim was to move here for 3 or 4 years, and then maybe move up to the Cotswolds, work in the Cheltenham area, because my in-laws are from the Midlands as well, in the Bromsgrove area. But put that plan on hold, because once we moved in, it became the centre of our universe. It was something where we loved to live. We started having children, and it was just a lovely vibe of the town. And so we very quickly realised it was somewhere we could spend a lot of time going forward. So we set up the business, and here we are. We've lived in Portishead for 25 years now. Yeah.
Fab. You just naturally set down roots.
Yeah, absolutely. Having got married here, had children here, the kids have gone through school, and I've sung with bands and the sea shanty group. I also volunteer for Portishead Lifeboat. I'm on the crew here, as well as running the business and employing lots of local members of staff.
Fair. So, do you have any sort of simple tips people could take away from this for their oral hygiene that they may not have thought about?
The main ones that I've thought about are making sure you're doing it, first of all. Is a lot of people who don't go to the dentist try and ignore it and brush it under the carpet, and then almost think, oh, I'm not going to brush my teeth because I don't want to disturb anything. So first thing is making sure you're brushing your teeth at least twice a day using a good fluoride toothpaste, because that helps protect the teeth and gets rid of the plaque, and helps fight off the different dental diseases such as dental decay, or caries as we call it, and also gum disease or periodontitis. If you're cleaning your teeth really well every day, not only the sides of the teeth but also in between the teeth, using some floss or TP brushes to get in there and get them nice and clean. Going to the dentist on a regular basis is crucial for regular checkups to catch things early. But also, as they say on the television, if you see bleeding, then that's not a good thing. It's usually because there's a presence of some inflammation around the teeth and the gums. And so not avoiding that area is the best thing to do. So if you see bleeding, it's not usually because people have brushed too hard. It's usually because the gums are upset and there's plaque and food trapped there. So that's the area you need to focus on and get it really clean to get the plaque out, get the food out, and get it nice and healthy. And then as it improves in health, it'll stop bleeding. So that's one. And one of the ones that I like, a lot of the patients like at the moment, is sensitivity control. There's several things I recommend on general eye sensitivity. As long as you've had a dental checkup and your teeth are healthy and there's not a cavity or a problem with your teeth, dental sensitivity, use 2 different brands of sensitive toothpaste. You can use a Sensodyne product, you can use a Colgate product, but use both of them, one in the morning, one in the evening, because there's 2 different chemistries and you get the advantage of both. But then in addition to that, we've got a product here for sale called GCMI Paste Plus, and it's a milk-based product. It's got calcium and phosphate in there, but it's also got some fluoride, and you can just rub that onto the surface of your teeth just before you go to bed. It comes in multiple flavours, and that really helps stop sensitivity. So that's my tip of the month, I suppose, or the tip of this summer. We've had a lot of people drinking a lot of icy cold drinks with the sunshine we've had, and they found the sensitivity, and so a lot of people are finding that really useful.
That's cool. Yeah, I'll have to check that out, I think.
Yeah.
So, slightly broad question.
Yep.
What, as a business owner, someone who's set up a practice here, has been running for 20 years, what is something that you've learned that you could impart to other businesses, or someone who's just perhaps setting up their own practice who's been through a similar process?
It depends on what industry they're doing, but because I am a service provider to the end user, as it were, we're not business to business. It's being visible to people and being like a real human being out and about in town. So having had children at the local schools, we used to go to the local church, going to the lifeboat, just talking to people in the street, engaging, smiling, looking them in the eye, and just getting to know people. One of the things that I've found very useful is also local marketing through Enjoy Portishead magazine. We've got a great working relationship with the two Tracys that run that magazine.
Yeah.
And we have a regular article every 2 months, every second month. We do an article about dentistry and about teeth or about dental care, etc. And that has really helped. But also, one thing I've done recently, about 3 years ago, I suppose, when I was forced off work with COVID for a little while, was to come up with a goal of what I wanted the team to believe in, as far as what service we were trying to provide for our patients and actually anybody that we come into contact with, whether it be patients, whether it be suppliers, services we use. We want to be the best dental practice for you, was the goal that I came up with. And that's been, it's caught the imagination, I think, of the general public, and that having an identity, a mission statement, or whatever you want to call it, having that goal of what the team is striving to achieve has really worked well for us, and the team really embody that, and they're always keen to point out to patients, and so that's been really helpful.
So not only engaging with the community, engaging with the contacts around you through any channels,
Absolutely,
but doing so with a focused vision and set of values.
Yeah, absolutely. And so whether it's you coming here to do this interview today, whether it's a rep coming to see me to sell me some new piece of dental equipment or materials, whether it be the patient walking through the door, or the family member of the patient who's coming in with a loved one that might be vulnerable or needs help and things, we want to be that place that people are happy to come and want to do business with us and feel like we can be trusted, etc. So that's what we want to achieve.
Brilliant, thanks. That's very helpful. What finally then, what are you hoping for the future of Portishead's business community?
Over the last couple of years, there's been a recent increase in business networking meetings, which have been really useful. So there's a group that meets at the Poacher on a Friday, and once a month on the first Friday of the month, I seem to remember. And that's a really good group. And from that, when it was first set up, there was a number of local businesses that were getting some online coaching from a local business coach, and that in itself brought on us all trying to develop our businesses and improve the way we were doing business, and giving us helps and tips. We were giving each other advice, and so it's not necessarily about networking to just get new links to do business with each other, but actually supporting each other and helping each other, and how we each do things slightly different to the other, or just asking questions of each other to say, well, how do you do that? Or I've got this problem, how have you tackled it if you've had a similar problem? And so just having those connections with local businesses has been really helpful. And now, of course, we've got the new incarnation of Together Portishead, which I'm hoping will be the new version of Chamber of Commerce. And so hopefully that can be a promotion for local businesses in Portishead, a support for local businesses as well.
Yeah.
And looking forward to doing some business with them.
Brilliant. So thanks so much, Nick.
No problem. You're very welcome.
So there you are. That was Nick Williams of Limetree Dental. I hope you enjoyed that interview. You can find more information about Nick and his products and his services over on his website, limetreedental.co.uk, which should appear at the bottom there. If you are a member of Together Portishead, I would be very interested to interview you and find out more about your business, how you got into it, any advice you have for local businesses in the area. If you'd like to expedite that process, you can always give me a nudge at dan@freerangeweb.co.uk if you want to get in touch, and we'll sort something out. If you're not a member but interested in joining, you can do so by going to togetherportishead.co.uk and clicking on sign up, or by going to this QR code that should be on the screen there. If you're not quite ready to join, but you'd like to be kept in the loop as to what's going on, what we're up to, any local business, networking events, this kind of thing, you can simply sign up to our newsletter, which will be here. But yeah, that's it. Thanks so much, and see you next time.